Let's head over to Kenya now, which has issued a new COVID-19 vaccination mandate. Authorities say those who seek government services as well as people boarding flights and using public transport should be fully vaccinated and have proof of vaccination by the 21st of December. According to the government, those who do not comply are to face a penalty. Kenya will launch a 10-day mass vaccination campaign from Friday. Since March, the country has reported over 253,000 cases of COVID-19, as well as 5,325 deaths.
We have so far received some 10.7 million COVID-19 vaccine doses and administered some 6.4 million vaccinations. I'm happy to report that among our priority groups, 88% of our health workers and 79% of our teachers are now fully vaccinated. It's becoming increasingly apparent that as countries battle the pandemic, a lot more emphasis is being placed on the need to have more people vaccinated. Vaccination is a critical pillar in the control of the pandemic as a long-term solution to prevention of severe cases of the disease, deaths, and enabler to return to normalcy.
We're now joined by CGTN's Robert Nagila in Nairobi and Dr. Aslam Dasoo, a co-convener at the Progressive Health Forum based in Johannesburg. Thank you so much for you both for being on the program. Robert, let's begin with you. Kenya becoming the latest country on the continent to impose a deadline for people to be vaccinated to access government services. What more can you tell us about this mandate, Robert?
Well, this goes back to earlier this year when the Kenyan government announced that it intended to have at least 10 million Kenyans vaccinated by the end of the year. Now, last month in October, the government lifted most of the COVID-19 restrictions because the infection rate had dropped below 2%. However, it says it's noticed that there's been a slowdown in the uptake of vaccines since then, and that's left it concerned that it will not be able to achieve that 10 million target by the end of this year. So what to do about it? Well, on the 26th of November, which is 4 days from now, it will roll out a massive vaccination campaign to get more people, as many people as possible, vaccinated. And by December 21st, a vaccine mandate will come into force. What does it mean? Well, simply, those not vaccinated by then will not be able to access private or public services. This is going to hit Kenyans hard because this is the festive period. A lot of Kenyans will be traveling for their festive holidays. So this is bound to get a lot of people who've not been vaccinated rushing to go get the jab.
Dr. Aslam, let's bring it to you in Johannesburg. How are governments going to implement these deadlines, especially here on the continent, if they don't have enough vaccines?
Good afternoon. I unfortunately could not hear your correspondent, but on the question of how we're going to reach the targets that we've set out, unfortunately, most countries in Africa, in fact, all of them, are supply takers. That means we are totally dependent on availability of vaccines that are produced elsewhere, and where certainly we don't stand in the front of the queue when it comes to being able to put forward huge amounts of funding. So I think there's going to be generally a missing of targets, but the targets are still important to maintain because it's an aspiration to reach those. And if we miss them, we just have to continue pushing for vaccination until we do reach a degree of population immunity that can help us overcome the worst phases of this pandemic.
Robert, from what you're hearing, how does Kenya plan to execute its plan?
Well, the government plans to hit Kenyans where it hurts most, this being a festive season. So no access to public or private services. As far as public or government services, you'll not be able to renew your driving license, marriage certificate, death certificate. You'll not be able to access any government services, your hospital fund, anything related to government or public services, you'll not be able to access, including government buildings. You'll not be able also to gain access to public transport unless you're vaccinated, and you'll have to show proof of vaccination. You will also not be able to access any private facilities or services, which means restaurants, hotels, I beg your pardon, restaurants or hotels or any other private services available here in Kenya. Now, the other worry for the government, because the vaccine uptake at the moment is only 8.8% of the population, is that we've got a general election coming in 2022. Now, you're talking about at least over 20 million Kenyans, 25 million Kenyans eligible to vote, who are supposed to take part in that election, with most of the population not vaccinated at the moment, and with the infection rate low. They believe that we will begin to see an increase in that infection rate. So they're trying to line themselves with other international standards, get as many people as possible vaccinated so that they can be able to open up the country, the economy, where tourism plays a huge, huge role. So that's the situation at this particular moment.
Dr. Aslam, you mentioned some of the challenges that a lot of African countries, you just say that there might be a lot of countries that are going to miss those targets, and yet it's important to have those targets in place. How, from what you're hearing, how are African governments planning to vaccinate at least 10% of their populations before the end of the year, and is it actually doable?
Well, that's remains to be seen. It's a modest target, and one would have expected in the normal course that we would have reached at least 10% of the population. But it's unlikely to be a uniform expectation or even achievement at this time. Look, I think governments are faced with a particular dilemma. I know here in South Africa, the government has opted to encourage voluntary vaccination. And while there was an initial big surge towards getting vaccinated, we've only managed to vaccinate some 24% of the adult population with a single shot. So a number of them, those especially taking the Pfizer vaccine, will still need to get their second shot to be fully vaccinated. Now, the problem that we face is with this declining uptake, there has to be an encouragement in some form, an incentive of some type to get vaccinated. And they're trying all sorts of measures, giving cash vouchers to people to encourage them to come. They are holding off on issuing a mandate for vaccines. And I think that's sensible for now. But if we end up in a situation where we are hopelessly under-vaccinated and facing new variants or new waves, I don't think we should, worry too much about instituting mandatory vaccines. This is something most societies are used to. You all get your children vaccinated, or they can't go to school. So that's a mandate, at any given moment. And so I think this as a practice is not a problem. The law here seems to be comfortable with introducing mandates, can't speak about other countries, but it's a very important last ditch, instrument that the governments do have to increase vaccination in the population. And we shouldn't be surprised if more and more governments go the way the Kenyan government seems to be going.
Dr. Aslam, thank you so much for that. Robert Nagila speaking to us from our newsroom here in Nairobi, and Dr. Aslam Dasoo, co-convener at the Progressive Health Forum, and he was speaking to us from Johannesburg, South Africa.